Ladies and gentlemen, announcing the arrival of our guest of honor, Yang Berhormat Dr. Zaliha Mustafa, and accompanied by members of the Board of Directors of KPJ Healthcare Berhad, Officer in Charge, Senior Leadership Team of KPJ and Damansara Specialist Hospital, as well as Medical Directors. Members to be seated. Assalamualaikum, salam sejahtera and a very good afternoon to Yang Berhormat Dr. Zaliha Mustafa, Minister of Health, Puan Nurhaiza Muhammad, Officer in Charge, KPJ Healthcare Berhad, members of KPJ Healthcare Board of Directors, Yang berbahagia Profesor Datuk Dr. Azizi Haji Omar, Encik Muhammad Rizza Muhammad Abdullah, Encik Khairudin Jaflus and Encik Rozaini Muhammad Sani, Dr. Rosman Muhammad Idrus, Medical Director, KPJ Damansara Specialist Hospital, Dr. Ahmad Shukri Jamaluddin, Chief Executive Officer, KPJ Damansara Specialist Hospital, our guests from the various cancer support associations, War on Cancer Malaysia, Magna, Persatuan Cancer Can Work, National Cancer Society, honorable guests, members of the media, fellow colleagues, ladies and gentlemen. On behalf of KPJ Healthcare Berhad, I would like to welcome everyone to World Cancer Day celebration and Radiotherapy LINAC launch. It is indeed an honor to have all of you here today, and thank you so much for joining us. Ladies and gentlemen, may I request for all guests to stand for our national anthem, Negaraku. Thank you, honored guests. Ladies and gentlemen, you may be seated. Ladies and gentlemen, to bless today's event, we would like to welcome Encik Muhammad Faik Razali to recite the doa.
Assalamualaikum warahmatullahi wabarakatuh. Al-Fatihah. Bismillahirrahmanirrahim. Alhamdulillahillazi ja'ala falahal ummatil batarahatil qulubiha wa najahaha min azafatil abdaniha min adraniha. Allahumma salli wa sallim ala Sayyidina Muhammad wa ala alihi wa ashabi tayyibin tahirin. Ya Allah, Ya Rahman, Ya Rahim, on this glorious occasion, we thank Allah subhanahu wa ta'ala, the creator of nature, the most generous yet most merciful, for bestowing upon us the ability to gather here for World Cancer Day celebration and Radiotherapy LINAC launch. With your mercy, Ya Allah, you grant prosperity and lasting health to the leaders and people of this country, so that we can live in peace and perform all our duties entrusted to us with excellence. Hopefully, this event will bring us blessing by making us all aware of the importance of taking care of health, while also strengthening the spirit of unity and friendship that live in our souls. Ya Allah, Ya Rahman, Ya Rahim, indeed, we have gathered today because of you, Ya Allah. We gather to gain knowledge, exchange opinions, contribute ideas, form alliances, and provide support to KPJ Damansara Specialist Hospital in order to further improve the treatment needs of our patient. Ya Allah, Ya Zal Jalali wal Ikram, bless our effort in providing the best treatment at KPJ Damansara Specialist Hospital, grant them healing and give them prosperity. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina azabannar. Subhana rabbika izzati amma yasifun wa salamu alal mursalin walhamdulillahi rabbil alamin.
Thank you, Encik Muhammad Faik. Ladies and gentlemen, without further ado, it gives me great pleasure to invite Puan Nurhaiza Muhammad, Officer in Charge, KPJ Healthcare Berhad, for her welcome address. Dipersilakan.
Thank you, Sarah. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera. Salam satu Malaysia. Yang berhormat Dr. Zaliha Mustafa, Minister of Health Malaysia, KPJ Healthcare Directors, Encik Khairuddin Jaflus, Encik Muhammad Reza Muhammad Abdullah, Dr. Ahmad Shukri, our CEO of KPJ Damansara, Dr. Rosman, sorry, Dr. Rosman, our Medical Director for KPJ Damansara, and of course, Dr. Siva at the back there, I can see you, is our Medical Director for KPJ Damansara too. Our guests from Cancer Support Associations, War on Cancer Malaysia, Magna, Persatuan Cancer Can Work, National Cancer Society, and my fellow colleagues from KPJ management team, medical consultants of Damansara Specialist Hospitals and as well as of KPJ Healthcare Berhad Group, members of the media, ladies and gentlemen. It is my greatest pleasure to welcome Yang Berhormat Dr. Zaliha Mustafa, the Minister of Health, to KPJ Damansara Specialist Hospital this afternoon to officiate the World Cancer Day 2023 celebrations and the launch of our hospital's Radiotherapy LINAC today. A warm welcome also goes out to all our guests and media. Your continuous support is always appreciated and valued. Yang Berhormat, ladies and gentlemen, this is a good platform for all of us to once again raise awareness about cancer treatment. We are grateful that we continuously receive the support and acknowledgement of Ministry of Health. In line with KPJ Group's Care for Life promise, the introduction of the new treatment based on advanced technology is a testament to our shared commitment to deliver world-class healthcare services and end-to-end patient experience. It anchors our ambitions to elevate our standards through the innovative use of technology, thus ensuring our patients receive the best care and treatment at all of our hospitals. For your information, Yang Berhormat, and ladies and gentlemen, KPJ Damansara is one of our 4 centers of oncology among KPJ Group. We do have the other 3, if I'm not mistaken, is KPJ Johor, KPJ Ipoh, and KPJ Sabah. KPJ Group offering cancer care services, including primary preventive services, screening, and early detection. Occasions such as these highlight treatment possibility which can be achieved using linear accelerator or well known as LINAC, primarily how it allows the delivery of safe and efficient radiation therapies to treat a broad spectrum of tumors throughout the body. We have had this technology in KPJ Damansara since 1997. The technology and equipment has since been upgraded 3 times since then, and our latest is the installation of current device, the Elekta VERSA HD, in late 2021. Since acquiring this technology in 1997, we gladly to inform that more than 70,000 treatment has been given to our patients, especially in KPJ Damansara. The revolutionary of LINAC in KPJ Damansara has allowed us to safely and efficiently deliver conventional radiation therapies to treat a broad spectrum of malignant cancers throughout the body, while also enabling sophisticated approaches to traditionally challenging cases that require extreme targeting precision. The results is highly precise treatment with shorter treatment times and the ability to offer highly advanced therapies while minimizing the impact of radiotherapy treatment to our patients' quality of life. The most common cancers treated at KPJ Damansara today using this device are breast, lung, nasopharyngeal, okay, I'm not a doctor, apologies, and prostate cancers. With these new additions, our patient can enjoy shorter durations of radiotherapy, faster recovery, as well as more targeted treatment will minimize side effects, supporting our commitments to provide the best possible treatment to our cancer patients. Yang berhormat, KPJ Damansara Oncology Center currently have 2 oncologist specialists, and it is supported by a dedicated team of experienced nurses who are specially trained to manage the physical and emotional needs of our cancer patients. We recognize, however, that there is a need to train more post-basic specialist nurses for oncology, in tandem with increase in the number of cancer patients in Malaysia, according to the National Cancer Society of Malaysia. Some 20,000 cases are detected each year with an average age of patient of above 40 years old. Over the past 2 years, new patients have emerged from the late 20s to early 30s age bracket. In addition, we found more children are also being diagnosed with cancer. Realizing this, another aspect of KPJ Damansara cancer fighting efforts is education, awareness, and prevention for the public. We wish to tackle cancer from all angles. This approach includes carrying out activities developed by KPJ own team, as well as through building partnership with non-government organizations. The objective is to join hands and guard the society against the scale of damage by cancer. We hope that through these affiliations and our commitment, we will continue to make an impact for individuals and communities of Malaysia, especially for our customers. Ladies and gentlemen, KPJ stands firm in our commitment to give our best to our patients. Let us all work together and be together on this fight against the dreaded cancer. Yang berhormat, please rest assured that KPJ will always be open to working with MOH again and again on project that is for betterment of Malaysia, especially on illness prevention. With that, I thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Puan Nurhaizam, for your speech. Ladies and gentlemen, now please allow me to invite Dr. Aminuddin Rahman Muhammad Maidin, consultant, oncologist, and radiotherapist, to brief us on the advanced radiotherapy LINAC system in KPJ Damansara Specialist Hospital. Dipersilakan.
Okay, thank you. Testing. Testing. Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. YB Dr. Zaliha, Minister of Health Malaysia, our distinguished guests, ladies and gentlemen, welcome to our event. As we emerge from the global COVID-19 pandemic, now we are seeing the significance of the non-communicable diseases, especially cancer. Cancer, like some people say, the big C, should not be a death sentence. So today we'll see some new developments that will give a better chance for survival and cure for our patients, and better hope for the patients and the family to live a normal life. So we are very proud that the Minister herself, YB Dr. Zaliha, is here to launch our new radiotherapy facility, which is the Elekta VERSA HD Linear Accelerator. This is by far the most advanced system that we have within the group and also in the country, and we are striving to be the cancer center of excellence in Malaysia and in the region. So what is this radiotherapy system all about? It's called a linear accelerator. I'll be going into a bit of technicality, so please bear with me. So this is the linear accelerator, and you can see and it hits tungsten target, which produces the photons, the X-rays. So this is what we call linear accelerator, or in short, LINAC. Okay, and this is a cornerstone or a very significant modality of treatment for our patients with cancer. So we are proud to announce that we have actually started this treatment called stereotactic radiosurgery for intracranial tumors, meningioma, after starting the service last year. And I'll present. So what is stereotactic radiosurgery? It's actually a treatment where we can really focus the radiation, especially brain tumors, and it's an alternative surgery. This is an example of our patient, 50 years old lady, intracranial meningioma. You can see the tumor here, okay, which is encroaching into the optic chiasm and optic nerve. Sorry. Sounds, yeah. Pegang. Off this one, yeah? Yeah, okay. Yeah, so this is a patient with intracranial meningioma, 50 years old, and we can see it's inoperable because it's coming quite close to the optic chiasm and optic nerves. And patient refused surgery. So the steps of doing this SRS treatment, first we do a planning CT scan with a thermoplastic mask to keep the patient immobile. And then we do a fusion of the planning CT scan and the MRI. You can see the area that we're going to treat. And this is the treatment plan where we are focusing on the tumor and avoiding the critical structures, the eyes, the optic nerve, and chiasm. And this is a patient setup during the treatment, and we'll do what we call a cone beam CT scan to make sure that the position is accurate and correct. And this is a video of the patient on treatment. Please. Yeah, this is the patient on the treatment machine receiving the treatment. And with our new facility, it only lasts about 15 minutes. So very fast and convenient for patients compared to other options like gamma knife, which may take many, many hours for treatment. So this is one session, and the treatment itself is 5 sessions over 1 week. So very convenient and fast for the patient. It's painless without anesthesia. Okay, so that's for intracranial tumors, tumors in the brains, either primary or secondary, which has spread to the brain. a similar technique called stereotactic body radiation therapy is also suitable for other cancers like prostate cancer and also for lung cancer. Especially we are picking up some of the incidental findings with a lot of the scans that we're doing, small tumors, and patient may not want to have surgery. So this is one of the options, stereotactic body radiation therapy for early stage lung cancer. And this new development that we have in our LINAC is 4-dimensional image-guided radiation therapy. So we can see the tumor moving, and we can do a plan which is very precise, covering the tumor and avoiding the critical structures. Okay? And lastly, breast cancer. Breast radiotherapy is also a very important modality for breast cancer treatment. And treating the breast, we are exposing the patient's heart and lung, especially on the left side. So we have this new technique called DIBH, deep inspiratory breath hold technique, where we can avoid the heart from the radiation beam. And this technique uses this surface-guided system where the cameras scan the patient and monitor the movement, and patient is taught to breathe in and the beam is on, and then when the breathe out, exhale, beam is off. So deep inspiration, breath hold radiotherapy technique. That's the latest for radiotherapy for breast cancer. Okay, this is our first patient treated in our radiotherapy system, Elekta VERSA HD, in December 2021. And since then, we've treated more than 2,300 sessions for patients. And we acknowledge and appreciate the support by the Ministry of Health in approving us to use this machine. And we would like to reciprocate by offering this service for patients from government hospitals, Ministry of Health, under the public-private partnership program. Ladies and gentlemen, thank you very much for your attention and support for our World Cancer Day celebration. Early detection and effective treatment save lives. Thank you very much.
Thank you, Dr. Aminuddin, for your explanation on the LINAC system. We would like to apologize for a slight technical issue just now, yeah? Ladies and gentlemen, it is now time for the most anticipated speech for today. Please join me in welcoming Yang Berhormat Dr. Zaliha Mustafa to deliver her speech and to officially launch the radiotherapy LINAC machine. Dipersilakan.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera, salam madani, salam perpaduan. To KPJ Healthcare Berhad Board of Directors, Professor Datuk Dr. Azizi Haji Umar, Encik Rozaini Muhammad Sani, Encik Khairuddin Jaflus, Encik Muhammad Riza Muhammad Abdullah, Dr. Ahmad Shukri Jamaluddin, Chief Executive Officer, KPJ Damansara Specialist Hospital, our guests from Cancer Support Association, War on Cancer Malaysia, WONC, Magna, Persatuan Cancer Canwork, National Cancer Society, Datuk-Datuk, Datin-Datin, colleagues from the KPJ management, medical consultants, members of media, ladies and gentlemen. First and foremost, I would like to express my appreciations to KPJ Damansara Specialist Hospital and KPJ Healthcare Group for inviting me to officiate World Cancer Day 2023 and the launch of Radiotherapy LINAC today. So it's correct, isn't it? LINAC, okay. I've been practicing the whole night. Congratulations to KPJ Damansara for taking the opportunity to organize this program. Celebrating World Cancer Day is commendable as it raises awareness about cancer, which is an essential element in the juncture of prevention and early detection of cancer. It is also our way showing solidarity and support to those facing this disease. Equally important is support for caregivers, as the responsibility of caring for a loved one with cancer is indeed prodigious. The Ministry of Health fully supports the commemorations of World Cancer Day to spread awareness and encourage its prevention, detections, and of course the treatment. Sufficient awareness and knowledge about cancer are essential keys to fighting it. With knowledge, prevention can be put in motion. However, awareness and knowledge alone will only have an effect if practiced. As the saying goes, the only action is reality. As it is known, cancer is one of the non-communicable diseases other than heart disease, stroke, or chronic lung disease. It is one of the leading causes of death in the world. The World Health Organization, WHO, estimates an increase of 93% or 19.3 million new cancer cases detected in 2020 compared to 10 million cases in 2000. That was double of the prevalence. Meanwhile, in Malaysia, my ministry has reported an increase of 11% in cancer cases recorded from 2012 to up to 2015, bringing the number to 115,238 cases from 103,507 cases from 2007 to 2011. So again, the increasing of numbers. In 2020 alone, 48,639 new cases and 29,530 deaths due to cancer were recorded. So that means half of the cases, almost. In the 5 years towards 2020, there were 128,018 cases recorded in Malaysia. Ladies and gentlemen, what does the statistic tell us? Belum makan, ya? What does the statistics tell us? A simple conclusion is that the number of cancer cases continues to go up year by year. Cancer is among the top 10 causes for hospitalizations in public and private hospitals. In our country, although positive progress has been achieved in cancer management, 63.7% of all reported cases were already in stage 3 and stage 4 when they were diagnosed. So that were the later stage. As you know, at the 3rd and 4th stages, the patient survival rate will drop significantly. This could be because of the late detection, lack of awareness, poor screening rates, or limited medical care availability, especially in the non-urban area. While treatment is essential, cancer awareness must also be prioritized. This year's theme of closing the care gap is especially relevant and serve as a reminder for us to step up our efforts in highlighting the disparities in cancer care and minimize the gap so that the appropriate treatment can reach everyone with absolutely no exception. With this, I applaud KPJ Healthcare for revealing the availability in the latest technology for cancer treatment in KPJ Damansara Specialist Hospital, which will help cancer fighters to receive the proper treatment. I understand that KPJ Damansara has taken the initiative to make availability the Elekta VERSA HD Linear Accelerator, mouthful, or LINAC, that's simple, LINAC, a cutting-edge radiotherapy system for cancer treatment. So we have seen just now, it was very interesting. Actually, I was talking to Datuk just now, you know, and I hope the collaboration with KPJ and MOH, I'll make sure that patients come here. You know, it's a very good treatment actually, invention, and I hope, I hope the collaboration will be, you know, strengthened. I was also informed that this system could perform sophisticated treatment procedures that employ exact targeting. This is done by delivering higher radiation doses at hard-to-reach areas or targets close to vital organs. Also, we have seen just now, and Dr. Amin has illustrated to us, reducing the risk of side effects and shortening treatment time. This would undoubtedly elevate the patient's quality of life, and I believe that with the advancements of medical technology, keeping a pulse and using the latest technology can provide patients with the best quality medical care, increasing their chance of surviving in cancer. Before I end my speech, I would like to call upon everyone to support MOH in alleviating the burden of cancer and addressing the cancer care gap in our country. From the government, healthcare providers, the NGOs, advocates, as well as patients. We all can play a role in solving pressing issues such as access or quality care. We can bridge any gap and move forward as one healthier nation by working together. Thank you very much.
Thank you, Yang Berhormat Dr. Zaliha Mustafa. Can I please ask you to remain on stage as we invite Puan Nurhaiza Muhammad and Dr. Rosman Idrus to join you for the Radiotherapy LINAC machine launch ceremony and also to sign the plaque. Yang Berhormat Dr. Zaliha, on my countdown, please place your hand on the launch pad to launch the Radiotherapy LINAC machine. And the count of 5. Tak payah, just put it on, yeah. And the count of 5, 4, 3, 2, 1.
Scanning. Identifying. Searching. Identifying. Match found. Access granted. Countdown initiated.
5, 4, 3, 2, 1.
Accessing archive.
Happy World Cancer Day to all caregivers, cancer survivors, as well as all those in the healthcare industry. Cancer doesn't have to be a deadly disease if we are vigilant and come for treatment and detection in a timely manner.
The state-of-the-art radiation treatment technology where we can deliver very precise treatment to a small area of the patient with greater comfort and convenience for the patient. With this state-of-the-art radiotherapy system, we are able to deliver very advanced radiation treatment, giving the patient a better chance of cure and minimizing damage and side effects to normal tissues and organs.
There you have it, ladies and gentlemen. The Radiotherapy LINAC machine is now officially launched. Yang Berhormat Dr. Zaliha, we would also like to also invite you to sign the plaque. Thank you, Yang Berhormat Dr. Zaliha. Can I request Yang Berhormat Dr. Zaliha Puan Nur Haizam to remain on stage to witness the next item in the program. Ladies and gentlemen, in conjunction with World Cancer Day, KPJ Damansara Hospital is pleased to announce our support to 4 cancer support associations, namely Majlis Cancer Nasional, MAGNA, National Cancer Society Malaysia, NCSM, Persatuan Cancer Can Work, and the War on Cancer. As a symbol of this support, we would like to invite Dr. Ahmad Shukri Jamaluddin, Chief Executive Officer, KPJ Damansara Specialist Hospital, on stage to hand over the mock check. To start, I am pleased to invite Mr. Yip Chong Wei, Marketing Director, National Cancer Society Malaysia, NCSM. Thank you, Mr. Yip Chong Wei. Encik Muhammad Najmi Kamal Amir, Program Manager, Brand and Awareness, Majlis Cancer Nasional, MAGNA. Thank you, Encik Muhammad Najmi Kamal. Dr. Mazna Muhammad, Chairman of Persatuan Cancer Can Work. Dipersilakan. Okay, thank you, Dr. Mazna Muhammad. And lastly, yang berbahagia Profesor Datin Paduka, Dr. Khatijah Muhammad Yusof, Deputy Chairman War on Cancer Malaysia. Thank you. Can I now please invite our guest of honor, Encik Muhammad Rizam Abdullah, and also Encik Karidin Jaflus, to join on stage for a group photo session with YB Minister. Dipersilakan. Wan Sharian, can we have you as well on the stage to join? Yang Berhormat Dr. Zaliha, kindly remain on stage as we would like to hand over a token of appreciation from the management of KPJ Healthcare. Thank you, YB and all guests. We are now reaching the end of the program. You may come, yeah. We are now reaching the end of the program, but before we go, I would now like to invite Yang Berhormat Dr. Zaliha Mustafa and all VIPs to the Radiotherapy Suite for a short tour and refreshments. And to all our remaining guests, kindly proceed to level 5 for refreshments. On behalf of KPJ Healthcare and the organizing committee, we would like to thank you for joining us today. Please continue to enjoy the rest of the evening. Thank you.